Welcome everybody to the HealthyU webcast series. This particular presentation is going to be given by me, David Cadena, on blood pressure optimization. Now, my background is in family medicine, primary care. I'm one of the primary care clinicians at our UT Health Hill Country location, which is near I-10 and Ralph Fair Road. But I'm a technically clinical assistant professor. We participate in medical student education, and also the medical director of our School of Health clinic, which is an acute care clinic at the main UT hub in the medical center that we have on Saturdays, and also a certified culinary medicine specialist. So with this presentation, I'm actually going to spend a lot of time on food, actually, food and diet as the main driver of blood pressure optimization. I'll try to talk briefly about some of the other aspects as well, but because of the culinary medicine background, I'm going to talk a lot about that. I'm not going to dive too much into different medication options. Those kinds of things are just very personalized to every individual, and kind of working with your primary care doctor, cardiologist, on fine-tuning those things is best in a medication discussion. So a lot of focus on more the food side of things today. And the setup for this too, there is a webinar chat, there's a Q&A, but if you're comfortable, just put some messages in the chat. I'll be trying to monitor that as we go along and try to answer them as we go along rather than bulking it at the end. But if I miss anything, we'll make sure to catch it at the end as well. So also, I'll have some questions on here, and I'll hope for some answers, okay? Some answers to some multiple choice questions. But let's go ahead and get started here. So on blood pressure definition, really it's the amount of pressure that's exerted by the blood pushing against the walls of the arteries, okay? Whenever you're getting a measurement, the machine will always have that top number and the bottom number. That top number is the systolic number, which is the peak pressure that's going through your arteries at that time. That bottom number, or the diastolic number, is the lower resting pressure that has blood flowing through. So when we think about good normal blood pressure, you'll see tons of charts out there. You'll see a lot of measurements saying 140 over 90 is the threshold for where we start medications. We'll dive a little bit into why that might be the case. So normal blood pressure is 120 over 80. Under that, very optimized, okay? Very low risk blood pressure, so that's where we are in the green on this table. As it starts to climb towards 130 over 80, we start to become a little bit elevated, start thinking about what kind of lifestyle changes can we be making. But as soon as we cross that 130 over 80 threshold, then we start thinking about more serious lifestyle changes. Some of those I'm going to get into today. And like I'm saying, that high blood pressure, which is marked on here as stage 2 hypertension, that's where we'll come in and talk to you more aggressively about medication management, especially if the lifestyle changes don't seem to be making enough of an impact for you. And on here, hypertensive crisis. Now, some people will show up to clinic even with blood pressures over 180, blood pressures over 120. I think some of this we've normalized a bit, like, oh, it's okay in a sense, but we don't like to see this. We really try to make sure that we're treating this more aggressively when you're this high. So that's why it says on here, contact doctor, consult doctor immediately when you're seeing those types of measurements, because you do require some kind of intervention, some kind of workup to come up with a solution. When you think about pressure, like the numbers, a lot of times they don't mean much to somebody, right? So to put this into more of a practical term, if you think about a pressure of 140 millimeters of mercury, all of these are in millimeters of mercury, that mmHg on the top. Now that is, when you try to correlate it to pumping up a tire or pumping up a ball, we use a lot of PSI on those measurements, right? Pounds per square inch. So 140 is equal to 2.4 PSI. That doesn't sound like a lot, right? But if any of you have ever used compression stockings, a lot of those are graded at 10 to 15 or 10 or 20. A lot of our vascular surgeons often recommend 20 millimeters of mercury, right? Those are the tightness of it. And if you ever tried to put those on, you'll see those are really tight, and they literally take a minute or two to put on. So if you think about that being 20 millimeters of mercury, when you're looking at the blood pressure being like 6 times that, right? 7 times that sometimes. So that's a lot of pressure on an artery just going through your body if you think about it in terms of that sensation. All right. So hypertension, also known as the silent killer. Unfortunately, most people are not sensitive to their blood pressure numbers. It's very difficult for most people to tell where their blood pressure is. A lot of people are surprised. It gets captured in other medical offices, such as a dentist office. They go in for a cleaning, and blood pressure is super high. So it's become known as the silent killer because you don't know about it, right? But so many people actually have high blood pressure. Almost half of the U.S. population have been diagnosed with high blood pressure, or it's uncontrolled in terms of if they weren't taking medications. And actually, a quarter of people only have good blood pressure control. So these numbers for the US are just not very adequate, right? We try to shoot for very, very good control in people, pushing them much lower, because if not, all these complications on the right can result, right? People could have a stroke years down the road, even from complications of high blood pressure. You can have issues with your vision over time because of that. Heart failure, a heart attack. This is a big driver for cardiovascular disease, essentially. So because of that, kidney disease, kidney failure, chronic kidney disease oftentimes is attributed to uncontrolled blood pressure for many years. Having uncontrolled blood pressure for a decade, 2 decades, and then just trying to get it under control still can have an impact on that kidney function. And then on the lower side of the slide here, sexual dysfunction. So things like erectile issues can also be a contributor or in a result of high blood pressure, actually. So we think about high blood pressure as kind of a heart thing, but you can see here it affects so many different systems, actually. So the silent killer, blood pressure. And then we're going to move on to interventions to consider. So I'm going to cover some of these in more detail, but some of these I'm not, so we'll hit on them right now, okay? But again, if you have any questions about any of these, just throw them in the chat, and I'll make sure to cover them as well, okay? So diet changes, the things in bold, we're going to talk a little bit more deeply about. So diet changes, reducing stress, and monitoring your blood pressure. We'll get into that more. Adding exercise, super big component, right? Not only does it help with your cardiovascular conditioning, but it can help you drop weight, which helps blood pressure. It is also another form of stress relief for many people, which can help drop blood pressure. It can help you lose weight on the right, weight loss. You know, there's a lot that goes into trying to lose weight. Everything has to line up, even things on this slide here, right? You have to sleep right, you have to exercise, eating correctly, controlling stress. Weight is a big portion of even other aspects on here. I usually tell patients who are wanting to lose weight in an effort to drop their blood pressure is that if they can lose about 10% of their body weight, which can be a rather high goal for some people, then a lot of times we can take them off of one blood pressure medication, or it would prevent us from having to add another one. So 10% is kind of a big goal, but it seems to be almost as good as a medication in terms of lowering your blood pressure. Limiting alcohol. This is another one that I think we don't think enough about, right? So in the US, we think about limiting men and women a little differently, and having a goal of 3 to 4 in a week of alcoholic drinks. But other countries are even catching on. In fact, I think Canada, even this past year or the year before, reduced their recommendation to 0 drinks a week, and that being the ideal, because we know that it will have an impact on blood pressure, longevity, your sleep comes back to that too. So limiting alcohol is another big one. Smoking. If you had one risk factor on here that probably needs to drop off the most, that would be smoking. Smoking, just a lot of effects on cancer risk, cardiovascular disease, that's the one probably to tackle first, even if that's one of your risk factors. So again, connecting back with your primary care doctor, talking about ways to handle smoking cessation. There's a lot of resources out there nowadays to be able to tackle that. Uh, we'll dive into reducing stress. And the right corner one on the bottom here is seeing your healthcare provider regularly. Sometimes we'll go in, we'll measure it high, but then do we make that follow-up appointment? Are we keeping track of it? Do we engage back with our primary care providers? That's a big one. It's really difficult to influence something that you're not tracking closely. So track it with your primary care medical home. So go back to your primary care doctors more regularly. So this touches on some of the drops that you can have with these interventions. I really like this chart because it can show the profound impact of sodium, actually. And we're going to talk much more about sodiums as we get into the presentation here. So DASH diets, we'll dive into that too. But a DASH diet with sodium restriction, you can see on here that you can almost double your effect of your blood pressure with that sodium restriction. The reason for that is that sodium, water will follow that salt anywhere it goes, right? You're going to absorb more of that water. So the less sodium you have, the less water that will remain in your vascular system. And if there's less water, there's less fluid, there's less pressure, right? So your blood pressure will drop because of that. So DASH diet plus sodium restriction, that is as good as a blood pressure medication will get sometimes. Dropping somebody 10 points on their blood pressure, that's a goal for a lot of medications. So that is just as good when we're thinking about being an active manager of our health. DASH plus sodium restriction, biggest effect on here. And you can see on there the slow sodium restriction alone also being a big effect. Some people try salt substitute. Now, you have to have a little bit of caution with that one too, because there are medications that you really have to be careful if you're taking excess potassium. We don't want your potassium to get too high in your blood. And the sodium is replaced with a potassium in salt substitutes. So it does work to lower the blood pressure, but I'd use it with caution, and I'd talk to your doctor about that one. Exercise, weight loss, kind of touched on those too, and decreasing that alcohol as well is another big one here. All right. So this is displaying more of the weeds of a DASH diet, right? So the DASH diet is actually pretty similar to a Mediterranean style of diet. It was derived from that, in fact. But Mediterranean styles, they'll separate on this right side where you see servings per day of lean meat, poultry, and fish. The Mediterranean style will separate out the fish and have it in its own category to focus on that even more so. It also has less talk about sweets. It's really not something that you consume in a Mediterranean style of diet. So sweets is another big one. It pushes more fats and oils that are low in saturated fats, high in polyunsaturated fats. But DASH diet is the one that I'm showing you is really truly proven to lower blood pressure really well. So you can see on here, we talk about low carb diets a lot. You hear a lot about it, right? But a DASH diet is a pretty high carb diet, as is a Mediterranean style diet. So high in whole grains, vegetables, fruits. About half of this chart here is carbohydrates. But again, we're talking about healthy carbohydrates, trying to stay away from the processed thing, the sweets. All of those are very minimized in this sort of diet. And then the proteins you eat are a smaller portion, but they're still lean. So a little bit more about sodium. I know I'm going to kind of hammer the sodium thing into you guys here. So if you can respond in the chat as well with an answer here, but which salt has less sodium per teaspoon? Sea salt, kosher salt, pink Himalayan salt, or table salt? So which one has less sodium if you put it in that same teaspoon measurement? What do you all think? Try to put an answer in the chat. I'll give you a few minutes to do that. Let's see here. A few people are going with B. Here I see a C. D. Okay. So yeah, this is a hard question actually, right? So we're not coming to a complete consensus on here. So the answer is, now I'm going to dive more into this, but the answer is actually the kosher salt. Kosher salt and pink Himalayan salt are actually kind of close. I mean, it depends who measures, of course, but these are the standard serving sizes on here. So the reason for this isn't what you think. These are not actually better for you in any manner. Taste can be a little different. We can use it different in the kitchen for different reasons, but when it comes down to the sodium content, they're actually the exact same thing. The difference lies in the fact that kosher salt and pink Himalayan salt, they're just more coarse, right? So if you grind them up and you measure that same teaspoon, they will all come out to be that 2,300 milligrams per teaspoon. And if you think about daily limits of sodium, that is your daily limit, 1 teaspoon of sodium. So if you're adding salt, if you're adding a teaspoon of salt, you're going way over the recommended limits. So again, it is the coarse nature of these things that it doesn't feel, it's not as compacted. That's the only reason it has less sodium per teaspoon. Okay. Here's another question for you. What has the most sodium per serving? A is for old-fashioned oatmeal. B, the instant oatmeal packet that you find. Usually it's in a little pouch and you empty it out and add the water. Cornflakes or 2 boiled eggs? So I guess I can help you along in this one by telling you the serving size probably. So old-fashioned oats, the serving size is a half cup. Same thing for the oatmeal packet. Usually there's a half cup in there. Cornflakes, the serving size is a cup and a half actually. So a lot more than the oatmeal serving size would be. And again, some of it is the density, right? So you can fit a lot less in the half cup of cornflakes than you can oatmeal. And then 2 boiled eggs, of course, that's the serving size. So let's see here. Let's see, B, C, B. So I think a lot of cornflakes and oatmeal. Nobody picked the boiled egg. So, but I guess how many of y'all eat a boiled egg without salt would be the other question, right? As long as you're not adding a teaspoon of salt to that boiled egg, probably it'll be okay. All right. So the answer is cornflakes. Some of that, again, it's because the serving size is a little bit higher. But I know one example I've given in a past webinar too is the sodium amount, right? So it's kind of surprising that cornflakes have a decent amount of sodium. They actually have more sodium than even tortilla chips was one of the examples I gave. But you don't think about cornflakes as being such a salty taste of an item, but a lot of it is the processed nature of some of these things. So if you take, for example, the old-fashioned oats versus an instant oatmeal, which is somewhat processed, it adds flavoring in there. And I think this measurement is actually for a maple oatmeal packet. There's going to be more salt in there, and it's just added salt, and it doesn't necessarily make the oatmeal salty. It's just it tries to enhance the flavor. So making your own oats, much superior. Most people don't even think about adding salt to their oatmeal when they're making it on their own. And again, just throw your questions on there if you have anything else that comes up. Okay? How to use salt. So we'll dive a little bit into the culinary side of this. So the actual purpose of salt is to make things taste less bitter. The bitter sensation that we get is a pretty it's a pretty old response actually. It's an old innate response to something being poisonous or bad for you, and it would keep you away from things in the wild. But nowadays, people are kind of leveraging the salt to make things taste so much better, draw us more to it. but to make things taste less bitter. If you do a home experiment and you have your black cup of coffee tomorrow morning, take a little bit of that coffee into a small glass and put a dash of salt in it. Now you're not going to regularly hear a doctor telling you to add salt to your coffee, but it's just for an experiment. You will notice that that coffee tastes much less bitter. And I don't want you guys to start using that as an additive to the coffee, but just as a test, so you can see that its purpose is to try to make it a little bit less bitter. So we're going to talk about how to limit your sodium when you're adding this salt into your foods. Okay? We'll get into a little bit of the canned foods and on the next slide here. But right now, think about adding salt later in cooking. If you add it early, what happens is we keep adding the salt. We keep trying to search for more flavor, and that's not what's going to bring it. All that's going to happen is that you're adding a lot more salt into your dish. So one of the suggestions is to cut the recipe's intake of salt in half when it's telling you to add it to a certain amount. And then you just taste it. And along the way, you can try to taste it to add more salt little by little, trying to avoid it early on. Right? Other things to think about that can add more depth and character to your dish are adding things with umami flavor. So umami is that rich, hearty kind of flavor. So things like mushrooms, additional herbs and spices, and acid is something else to think about adding. So there are many companies now that try to push salt-free seasonings, right? And that's the herbs and spices. I know that they taste a little bit different, but your palate can actually adjust to these things. You just have to give it some time. Acid, more of an acid finish. Just again, trying to add more depth to that dish rather than trying to add more salt to that dish. Another thing that I see people try to switch to is liquid aminos, right? Liquid aminos, it's kind of been publicized as a healthy alternative to salt, to soy sauce, but it actually has a pretty similar sodium content to soy sauce. So I would be careful and I would read labels. Reading labels is going to be a big deal if you're trying to reduce your sodium intake. All right. So canned foods. On the left here is the nutritional facts for a can of corn that has no salt added. Right? On the right is a regular can of corn. It doesn't say salt added, right? It's just a regular can of corn. So a lot of people are just drawn to that because they're not looking to have an additional item that they may be paying for with a no salt added. It's a regular can of corn. So if you look down this and reading a nutrition label, again, super important, okay? So on here, the serving size for both of these, it's a half cup of corn, has 70 calories. Corn is great, right? It's a whole grain. Even corn tortillas, they're whole grains. So these are going back to that DASH diet, part of a healthy DASH diet. So half a cup, 1 gram of fat, same amount of polyunsaturated fats, which are thought to be a bit healthier types of fats. But the sodium, you can see the sodium is 30 times more on the regular corn than on the no salt added corn. Same carbs, same fiber. There's a little bit of sugar built into corn, just some of them just on the sweeter side. And there's also protein in this, right? So the sodium, it's a big deal. If ways to adjust this though, if you empty out your can, if you rinse out the corn, you can reduce that sodium almost 40%, but you can't take it all out. And even if you reduce it 40%, you're still so much higher than just using the no salt added. Okay. So some people will just avoid cans altogether, but you can do it. So frozen corn, no salt added corn, those are fine alternatives if you have high blood pressure, if you're trying to keep your blood pressure down. But again, if you still have those regular corn cans on your shelf, at least drain them, rinse them, try to get as much sodium out of there as you can. All right, the next slide here. Oh, okay. I'm going to skip ahead a little bit to this blood pressure check one, actually. like I was saying before, it's really hard to change something if you're not keeping an eye on it, if you're not monitoring it and checking it, right? So this is a guide of how you should be checking your blood pressure. Your back should be supported. You really shouldn't be talking. And I would admit in clinic, sometimes we're shuffling people back. We're trying to talk through some of these things, but we really try to keep things calm and minimize any interruption to measuring your blood pressure. Checking your cuff size also super important. Some of the ones you can buy at the store, they come in a standard size, but it might be too small, too big for your arm. So make sure that you're within that reference range of your arm according to the cuff where it's showing you the lines are. And again, not trying to measure through heavy clothing, sweaters, things like that. Your arm should be at that same heart level right there, but just trying to be relaxed. And the top right has other strategies to think about. Did you just have a lot of caffeine? Do you have to go to the bathroom? Other things to think about that could be disrupting your blood pressure. Okay. Uh, Validated electronic cuff. That's also another important one. So the way that I ask patients to validate their cuff is actually bring it into the office, right? For people who feel like they have white coat hypertension and it's only high in office, we prove that by checking their cuff, bringing it here. If their cuff is showing that they're high in office as well, then potentially they could have some level of white coat hypertension. And then we can trust that cuff at that point. So when they go home, if they're fine, we trust the cuff. So I would cross-reference it and make sure it's pretty validated with your own primary care office cuff measurements. And I think we had a question, something similar on this topic here. It says, the question is, what do you recommend as a blood pressure monitoring device? So yeah, again, there's a lot of brands out there. There's a lot of expensive machines, but I would generally try to find something affordable and then just go cross-reference it in the clinic next time you go. Make sure that it's working out nicely for you, and you can always check it every year when you get your annual physicals. So just get what's affordable and bring it in so we can check it here. But make sure it is an arm cuff. Wrist cuffs have a lot of variability between them, and we generally don't recommend the wrist cuffs because of that. So try to get an arm-based cuff that you can use. Let's see, the other part of that question is the normal pump style with armbands sold in pharmacies. Yes, you can do the one that has a manual pump, but you have to be careful, obviously. It has to be on your other arm that you're pumping it. The ones that are automatic are still perfectly fine. To manually check a blood pressure would require a little skill on your own to do it, but if somebody can do that for you too, that's perfectly fine as long as that person feels comfortable in doing so. And then there's other new devices on the market is another question here. There's things like KardioMobile or other heart monitoring devices, even the watches that you can wear. They're honestly fairly accurate, right? So they don't give you big measurements. Like when we get an EKG in clinic, for example, that has 12 leads on it. So it's measuring different parts of your heart for us to get a sense of the size of your heart and trying to measure if you have any straining of your heart. So it's a lot more informative. The ones that you can get on your own and use at home, it's more important for a rhythm, right? So I've had patients catch abnormal heart rhythms, and what that does is just prompts us to investigate it a little bit more. Should we be getting a longer term heart monitor, as an example? So those are helpful in giving you a sense of what your heart rhythm is like, but I don't know that it's enough for a blood pressure type of measurement. I'm going to go back one slide. So another one that we'll talk a little about is stress management. So on the graphic here, it's things that matter, things that you can control, and whatever's in the middle is what you should focus on, right? This is an easier said than done thing, right? Um, but but again, working through that on its own, it'll give you some more power feeling of what you can do with your own life. So there's a lot of stress management techniques out there. Obviously, working with a behavioral health person, which we can often consult to, a therapist, psychologist, these are the experts in helping people manage their stress. But there's some activities on the left side that you can consider. So guided meditation, there's even apps out there nowadays to walk you through meditation activities, to walk you through deep breathing exercises even. So I'd consider searching through some apps that you like and see if there's any that are worth it to you. But coming into the clinic, even and giving some advice on these things we can do for you. These are shown evidence-based measures to bring down your stress. Another big one, exercise. These have a lot of general themes for health, right? Exercising, sleeping right. All of these are interconnected. So stress management, trying to find an exercise you enjoy. If you don't like to walk, it feels boring to you, then pick something else, right? Can you get on a stationary bike? Can you do videos at home to try to exercise if you can't go out? Even if you're hurt or if you don't have great mobility in your legs, can you do other chair exercises? Fortunately, that's really utilizing technology and looking for these videos online. Um, I try to do something to help with stress in form of exercise. Another big one in modern technology wise is limiting phone use. Phones are such an easy distractor, right? You log on to check one thing or you get a news alert. It's so easy to flip your screen and get into another app and start scrolling, right? I think people have scrolled for hours on these things before, but it's not truly limiting your stress. All it is adding more distraction and more stress. So there are ways to limit phone times. There's timers. I think some phones even have a way to shut off some of these things that you could be doing. So another consideration. And then finding connections, right? The community, the sense of community, right? So there's a lot of community centers where people will search for, and like I was saying, the experts in this thing are behavioral health people. They have a lot more resources to share with people to try to find those connections, try to find like-minded people that you enjoy being with, and help you de-stress throughout your week even. I think we're actually coming up to the end of this presentation. So the stress management, Dr. Myra Bettis is going to take an even deeper dive into managing stress in the modern world. So she'll really expand on some of these things that I mentioned in our last slide here. This HealthyU webinar series is quarterly right now, so the next one won't be until May 16th, but I would mark that on your calendars. And if anybody else has other questions too, I'm happy to take them in the chat here.